In this video, I want to talk about why most dental x-rays that are taken out there are actually worthless. And that sounds very counterintuitive because good medicine is good imaging. But in order to interpret radiographs, just like in order to interpret an MRI, a CT scan, or an ultrasound, all imaging, you have to have a very, very deep understanding of the anatomy that you're evaluating. And in veterinary schools, we're not taught a deep anatomy of dental disease, and so it makes it really hard to thoroughly evaluate radiographs very well. Furthermore, in 95% of cases, if you truly understand the anatomy, you'll actually be able to figure out what the problem is without the radiographs. For me, radiographs are most helpful for surgical planning and to make sure that there's no complicating factors going on at the apex of the tooth. Diagnostically, radiographs, for the most part, for me, are not necessary with dental disease. There are certainly cases where they are crucial, don't get me wrong, and there's cases where advanced imaging like CT scans are crucial. But generally speaking, if you understand anatomy, pathology, how signalment can affect these things, you can figure out the vast majority of dental disease by doing a thorough oral exam and an extra oral exam. And we teach a lot of this. If you're interested in learning more about some of the things we cover in these videos, you should check out the Academy of Equine Dentistry in Idaho. We have veterinarians and technicians from all over the world that come together 3 times a year, and we work on well over 1,000 horses together in a live setting. And so it's a really great environment for expanding your clinical skills, clinical knowledge, and it's a great environment because we're actually working on cases every day, and so that's the best way to learn. So what I'm going to show you here is a case where we've taken a bunch of radiographs, and really we don't really see a whole lot on any of them. So let's go ahead and look at it, and we'll show you. Okay, so this is a 7-year-old horse that's got a history of right-sided unilateral nasal discharge associated with a sinusitis. And so here we took a radiograph, an oblique of the right side. And really, if we look at the lamina dura around these teeth, everything looks pretty normal, pretty healthy. You could maybe make a little argument here, but you have to be really careful over interpreting radiographs. This is another one here, another view of the right side. And again, this is all what I would call pretty normal. We can see a nice lamina dura all the way around the 9, the 8, the 10, 11. Here's another view, just to be sure. So we're taking multiple views at slightly different angles. Everything looks great. Here's a palatal view, looking at the palatal root, and we've covered that in some other videos. We've covered how to take good dental x-rays on some of the other videos. You can see some of the links attached. Okay, here's a DV. We can see we have some fluid in the sinus, but we're really not seeing a whole lot. Maybe a little spot right here, which we'll talk about in a minute. Okay, this is a contralateral side for comparison, and more of a straight lateral just to look for any kind of cyst or anything in the sinuses. And then a DV looking at the septum. All right, so here we can see the number 1 quadrant, and that all looks pretty nice. You know, there's nothing that really just jumps out at you. Everything's looking pretty good. If we look over at the other side for comparison, that all looks pretty good as well. So at first you might think, well, there's just not a whole lot here, but let's go take a little closer look. Okay, so here we're going in, we're looking at the 106, 107, 108, we're a little foggy here, 108, 109, 110, 111. So if we look at the number 9 a little closer, what do we notice? Well, we can see we have an open pulp right here, and an open pulp right here, and an open pulp right here. So pulps number 1, pulp number 3, pulp number 5 are open. Okay, that's interesting and definitely abnormal. All right, so let's investigate a little further. Here we can see a little bit of irritation, and if we look a little closer right here, it looks like we might have a drain tract. So here I'm using a very thin probe, and I'm going to look at this area. Let's see if we have pus staining through here or not. Because this is definitely an abnormal finding. That definitely goes in here deeper than it should. So that makes me think that we have a draining, discharging tract right here. And then we'll look at this area. And this one maybe even a little bit deeper, okay? So now, just based on our oral exam, and yes, I'm using an endoscope, but honestly, you can diagnose this no problem just using a mirror. You don't need to have a fancy endoscope to diagnose dental disease. It's nice, it's great, I encourage it, but what's most important is knowing the anatomy, the pathology, and you can figure all this stuff out with a mirror, an explorer, and a periodontal probe if you understand the pathology involved. So don't let the idea be that you have to have all kinds of equipment. It's knowledge that matters, not the equipment. So we've got that tooth extracted, and now we can show you guys, we actually took it out and we sectioned it in half. And it's always interesting to look at these teeth because once you get them out and you look at them, you learn a lot by studying the pathology that you're finding. So let's go ahead and take a look here. We'll come a little closer and we'll show you. So this is what the tooth surface looked like. We cut a little piece of the tooth off to make the extraction easier. This was the open pulp here, open pulp here. This one's not great. And then here's a part of the infundibulum, and this is also part of the infundibulum. So we sectioned the tooth in half, and now let's look inside. So this is all infected pulp going all the way up to the root, okay? And that's what was causing the sinus infection. But radiographically, remember, we didn't see a whole lot. So this just reinforces the point of how important it is to do a thorough oral exam and to understand that open pulps are actually very serious. They may not look like that big of a deal on the occlusal surface sometimes, but if you get deep within the tooth, this is all essentially like manure right here. What this is food and bacteria that are trapped together and fermenting inside of the tooth. And all that infection has to go out somewhere. So either one of two things is going to happen. So infection, anytime we have an infection, there's going to be pus that's produced. We have inflammation, infection, we have white blood cells that come in and bacteria, and that creates pus. And pus needs a place to exit the body, so it's always looking for the path of least resistance. Sometimes the path of least resistance can be breaking into the sinus cavity or sinus compartment, and that's why we get a sinus infection. Other times it may be noticeable as a draining tract under the jaw, under the mandible. Oftentimes we'll see draining tracts in the mouth where the pus being produced is draining into the oral cavity and the horse is swallowing the pus. So something like this may not look that bad to the inexperienced eye, but when you factor in the fact that you essentially have basically what amounts to fecal material within the pulp chamber, that produces pus, and that pus has to go somewhere. So these dental infections are actually very serious, but horses are so stoic and their desire to eat and survive is so strong that they may not show a lot of signs. But invariably when we get these types of teeth out, typically if it's a performance type horse, the rider will notice some improvements, and obviously the horse is going to be healthier and happier after these teeth are taken out. So don't underestimate the significance of open pulps, which reflects deeper endodontic disease, and don't focus on radiology until you understand how to do a good oral exam. Right now, everybody at every meeting, they're saying, oh, you have to go out and buy oral endoscopes. I'm all in favor of that. As I've said before, I love them. But an oral endoscope, if I go out and buy a Formula One race car tomorrow, yeah, I can drive a lot faster, but I don't know how to drive one of those, so that's not the answer. You have to have the knowledge to go with it. And veterinary schools, until they start changing what they're teaching, a lot of people don't have the knowledge. So before you go buy and spend a lot of money on diagnostic equipment, Go by knowledge, and then once you have the knowledge, you can start to add some of these additional layers that help make your practice better and higher quality medicine. So that's it on don't overuse radiology. That's my rant for the day.